Madam Chair, members, Karl Spock again with Sunset staff. And I'm going to talk first about the first couple of issues in the staff report, which deal with system-wide organization and operations. Sarah will cover the remainder of the issues in her testimony. The review of the Health and Human Services structure does take us back to House Bill 2292, which, as you know, it was the landmark bill that created the current makeup of the Health and Human Services system back in 2003. Now, a lot of that bill dealt with getting cost savings in a time of a very serious budget shortfall, as several of you will certainly remember. But the bill also consolidated human service agencies from 12 to 5, with the goal of improving services by eliminating the fragmentation that forces clients to have to go to multiple agencies to get what are often related services to meet their needs. The state has made progress toward this goal of HB 2292, but we haven't gotten there yet. The design of the system into 5 separate agencies allows significant fragmentation to go on in programs like Medicaid, split in 3 agencies. The fragmentation continues to make it hard for clients to find the services they need, hard to efficiently administer a program, and hard to control costs. There's another problem that's more subtle, but it's definitely important that you see in various ways if you observe the system for a while. The design of the system blurs clear lines of accountability, which in turn makes it harder to get things done. Here we have the very unusual situation where the Health and Human Services Commission is ultimately responsible for the operation of the whole system. However, at the same time, you have 4 agencies answering to HHSC that are legally separate agencies with their own commissioners, their own budget, and the ability to pursue their own goals. So the question sometimes becomes, who's in charge? Is it the executive commissioner, or are agency commissioners running their own agency? This kind of fuzziness opens the door for agencies to follow their own initiatives rather than pulling together as a system. It makes it harder to get rid of silos when staff see themselves as employees of one of the agencies rather than the Health and Human Services system. We address these problems of fragmentation and accountability in 2 ways. First, our recommendation takes away separate agency status, consolidating agencies into one HHSC and giving the executive commissioner clear authority. Second, we recommend grouping the same or complementary activities together to promote integration of services to clients. An example there would be, for instance, putting all women's health programs together. These big and controversial changes require balancing a lot of elements, and we understand that. One of the concerns we have heard most often is that the recommendation creates an agency that's too big and gives the executive commissioner too much power. We'd suggest on that the system the executive commissioner is responsible for now is already big, but with an organizational structure that doesn't allow it to work as well as it could. The executive commissioner, yes, he does have a lot of power right now too, but without clear authority, that power doesn't always translate well into clear and consistent directions to integrated services. The recommendation removes the structural barriers that individual agencies present to the executive commissioner's clear authority. Also, the major division heads below the executive commissioner, in our view, would be as important and responsible as current commissioners are. However, these responsibilities now would be exercised with clear accountability to the executive commissioner. If I could just say a word quickly also about issue 2, it's related in the same sort of way, and then we can answer questions whenever that time comes, Madam Chair. But
Sure.
Issue 2 deals with consolidation of the system's administrative services in HHSC, which was required back in House Bill 2292 as one way to streamline operations and save money. Recommendations in Issue 2 would move HHSC forward to complete that task and improve HHSC's oversight of system contracting and information technology. We received little opposition to these management recommendations.